Good evening, everybody. Hello, welcome to our channel. My name is Marie Elsie Ade. I'm a PharmD, a pharmacist, and I am here with my best friend.
Dr. Judith, and I also have a PharmD and a couple other degrees. I'm also a pharmacist in
And together we are
our best
best
friends
friends
on
on
drugs.
drugs. We'll get it right one of these days.
One day.
One day,
I
one
work
day.
in pharmaceutical industry, and Marie?
And I worked in a health system. I'm the director of pharmacy in a health system.
And what do we
So
say? This is just our opinions, because we're just talking as friends, but I'll let you give the disclaimer.
yeah, we have to do a lot of disclaimers for this one. Yes, we are just two friends talking about healthcare, mostly pharmaceuticals and the pharmacy industry, and how drugs impact your life and healthcare, and how that happens. It's going to be our opinions, how two friends talk to each other, our opinions. It has nothing to do with our employers
Mhm.
or a professional life. And whatever we talked about, it is by no way advice, medical advice. You need to check with your doctor
Mhm.
before you do anything that we say here. And that's it. Let's start with the show. What are we talking about today?
Well, today we are talking about Trump's picks for the top healthcare jobs and how it might affect healthcare, just their understanding of healthcare. So let's just
Well,
dive in.
let's dive in. I feel that all of these picks is like a bomb that's going to be like and break healthcare up in millions pieces. And on the other end, they're going to have to put it back together. Healthcare is not going to be how we think it's that we've been practicing and stuff. It's going to be very different because these guys are very anti-establishment.
Yes, very. I think the system of healthcare will look different. And we've discussed it before, where the consumer, the patients really are going to have to be active in their own healthcare.
Yes, to survive these
Survival is key.
both as a healthcare consumer, as a patient, and as a healthcare professional, we're going to have to look at things differently. We're
Mhm.
going to have to prioritize self-care. We're
Yes.
going to have to prioritize primary care, and we're going to have to prioritize chronic diseases because from what I've read with these guys, that's what they are into. So let's start with the big boss. He's going to be that has been nominated and that everybody is scared of is kind is scared of is Robert Kennedy Jr.
Yes.
RFK.
RFK. Now, let's just think about RFK. So he's tapped to run, and make sure I get it right, the Department of Health and Human Services.
Yes, the Department of Health and Human Services is a huge department.
Yes.
That's the department that is in charge of all of the healthcare of the United States, right? And have
Mhm.
several agencies underneath it. It has the Center for Medicare and Medicaid,
Mhm.
CMS. It has HRSA.
So many agencies.
So many, yeah, so many agencies like HRSA is her, the FDA is under Health and Human Services, the CDC is under that, and a lot of agencies, the Department of Indian Health is
So
under,
basically, he's going to be able to put his hand and his stamp on almost
right,
every single part of our healthcare system. But
right,
the thing that everyone is kind of concerned about is his stance on vaccines.
right. But it's not just his stance on vaccines. He has stance on everything else. He had sued Monsanto and kind of like won.
Mhm.
for their pesticides. So he's also into the quality of the food that we use. So that's
Now that I
why,
can't complain about.
and that's why him being over the Food and Drug Administration is a little bit worrisome for some people because of the fact that he believes that the food that we are currently consuming is making us sick, which I do think the food is making us sick. Um,
Oh, but that is just our personal opinion because we don't want any organization coming after us. I think that we have to take responsibility for the food that we eat, and it's not those organizations that are making us sick. And the food is quite healthy,
the
right?
food is very tasty.
Healthy and tasty. There we
Very
go.
tasty.
Because we don't have Oprah money to go to court. So keep going.
Well, the thing about him, that's the big thing that a lot of physicians are worried about because of what happened in Samoa. Because he's against vaccines, as you know. So he
Yes.
wrote to the Prime Minister of Samoa letters saying that he should not vaccinate the kids and that vaccines are like making the kids sick and things like that. I'm paraphrasing, by the way.
Okay.
And then lo and behold, there was an outbreak of measles in Samoa, and half of those people, like a lot of the people that were afflicted with the measles did not take the vaccine. And I'm like, measles was a childhood disease that you did not see anymore, right? It
Yes.
used to be called German measles when I was growing up, and I guess they
I
removed
remember that.
they removed the German out of it because of discriminatory thing, and it really didn't come from Germany. It's a virus, you know. What I remember though is like I'm from a third world country, right?
Mhm.
So I do remember have seeing people with a lot of the diseases that Americans take for granted that don't exist with childhood, right? So
Yes.
I remember the measles, people with measles and their chicks will be like this huge, and
Mhm.
they had to like put a handkerchief from here. That's
Well, I haven't seen that one. And thank goodness I haven't. I didn't get to experience that wonderful experience there. But
and that's how you knew that the child had measles because they had a handkerchief on top of their head like this, going from the bottom of their to the
what was
top
the purpose of the handkerchief?
to prevent their jaw from falling out. To prevent their jaw from falling out.
Would it actually fall out?
I don't know. I was a child. I have no idea why people put the handkerchief on top.
What I'm concerned about is not just his stance on vaccines, but also clinical trial studies.
What is his stance on clinical trial?
He doesn't really believe in clinical trials. So those trials of drugs that are in the process of approval, but they need these trials to see if they're safe and effective, may also stop.
Wow. So what will happen with the NIH if it doesn't be, because that's their main purpose. There's a lot of diseases that are like rare diseases that only
Yes.
NIH can treat them. Like they are so rare that you don't, so rare and so dangerous sometimes that you don't even have them outside in main
So
hospital.
we don't know how all of this is going to play out in the future. These are just points that, we have to consider for the future. We don't know how what's going to happen.
Right. And his lawyer has sued or is suing the FDA to remove the polio vaccine to, yes. I'm like, again, I'm sorry. I am from a third world country. I'll keep saying that. I'll keep saying that until it reach people's head. And I've seen people with polio, right? That live through polio. And I know here people don't see that and they only see old pictures of 1940s, 1930s when people were afflicted with polio and they had the iron lungs where they had to help them breathe. Well, guess what? In a third world country, you don't have iron lungs. So therefore, you die if you.
I think there was one person still with an iron lung.
Yeah, he's still alive.
And
Yeah,
it's breaking down, and they have to keep finding parts because they don't make them. So if
exactly.
something breaks down, that person is, there's nothing they can do.
Well, so like I said, growing up, our cook had polio as a child, right? And
Okay.
it kind of like deformed him. You want to know, like instead of his feet being like this, he had a
Yeah.
foot that was normal and the other foot was like this.
Ooh.
Okay. And he had to walk on this.
Ooh.
Okay. So I'm like, I've seen firsthand the effect of not being vaccinated. Okay. So
Mhm.
I'm very pro vaccine. I am a little bit wary of the scheduling of the vaccine, right? Because they
Mhm.
give the children many vaccines all at once.
Yeah.
However, I feel that if you have an issue with the scheduling of the vaccine, you work with a pediatrician to schedule your vaccines in a better,
And you can. I mean, when my son was young, I did have concerns with the scheduling. And when it came time for him to get a certain vaccine, I said I wanted to wait. And of course, why did you want to wait? I said, it's my preference to wait. I'm not denying him the vaccine. I just want to wait to a certain age. And
right,
he was fine. Once he hit that age, it was more of a spacing for me. I was more comfortable giving him the vaccine and everything was fine. It was just, I did not like the scheduling. So I know physicians will work with parents. I'm a healthcare
hmm
provider. And I did have some reasons. And I said, well, you know what? Just out of concern, my own concern, let me just delay. It wasn't
right.
I abstained, I delayed the administration.
Right. It's not like you're not going to take the vaccine. It's just that, okay, let me delay some of the vaccine, even though some physicians don't believe in that. But some pediatrician does
Yep.
work with you on delaying some vaccines
And
so
that was
that,
16 years ago. So
yeah,
you just
so
have to
if
speak up.
you just have to say, hey, I don't feel comfortable with having all these vaccines at once, but
Mhm.
can we, even if you have to go every month, rather than every 3 months or every 6 months, so be it. Um, and the other thing that people are not really talking about that he wants to do, and that's why the physicians are having a cow is that
Mhm.
he wants to change the physician's payment structure.
Affecting their money.
Ooh, yes. I actually would like, I'm like having popcorn watching that. I'm like ready to watch that fight between him and the AMA because the AMA is like, nobody can do anything but us. We are the physicians. We take care
Mhm.
of the people. Nurses, pharmacists, they can they cannot help, you know, but we are the physicians with all the money.
Don't
so
affect our money.
so I'm like here going like this, watching the
Okay.
popcorn.
You think you're Olivia Pope right now with a glass of wine and popcorn.
Oh yeah, a glass of wine and popcorn. Too bad I don't drink anymore, but that would be I would be
A
like a glass
mocktail.
of water and popcorn, right? So so that's what I'm like. I'm ready to see that fight. But I kind of like agree with why he wants to change the
Mhm.
payment structure. He wants to change the payment structure to be more favorable for primary care physicians.
And I can
You know,
understand that. Why we put
right,
the money into specialty, you go to specialty because you've waited so long. But if you had a primary care, maybe you could address the issue sooner.
right. And the United States have a shortage of primary care
Oh,
physicians.
yeah.
That's for sure because they don't really get paid. When you think about it, a heart surgeon and stuff are making like way, 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 way more money than a primary care physician. And a primary care physician is kind of like responsible for the whole patient and can take care of 80% of the patient's ailments,
Yeah.
right? So, and the other people that you go to prevent you from getting sicker, right?
Yes.
The specialist is there after you've gotten sick in order to fix what, had you gone to a primary care physician earlier, would have been taken care of earlier.
Okay.
So he wants to do that, and he wants to remove fluoride from the water. So he's having a fight with the American Dental Association.
It seems like he's ready to fight everyone, but what can we do?
I haven't seen what, well, the thing, I haven't seen what he wants to do to pharmacists yet, but I know that he does not believe in all these medications being done and being dispensed and stuff like that. So let's see what he says about pharmacy. Okay. And,
Let's see. But
and
one thing that I want to bring up is that he actually supports access to abortions, but the physician that's tapped Whedon would head the Whedon, what's his first name again?
well, Dave Weldon.
Oh, oh, is it Weldon?
Hmm.
He's a
I know, whatever.
yeah, he's a proponent, and he is an abortion opponent.
He's,
So it'll be interesting to see how those two in the same administration will work together.
well, we'll see. That's going to be his boss. So whether or not you're an opponent or not, what you do, whatever your boss tells you to do. Otherwise, unless your boss's boss, him first.
So once again, let's bring out the popcorn.
And watch. Well, Dave Weldon is actually from Florida.
Yeah, I
He
know.
was a congressman from Florida in that area where all the old people live. Uh, yeah, I know, I know,
They don't
I
even have to worry about abortions.
know. Yeah. Okay, when you think of Florida, Palm Bay, old people.
Old people,
Yeah, Merritt Island,
old people.
Melbourne. Okay,
Everyone
so
over 40. Everyone over 40. There are no
every
kids.
over 40, over 60. That's where these people live. Cocoa Beach and all these places. That was the representative. He's not a fan of vaccines, so he has something in common with with RFK. Maybe they'll bond
Over that
that
and
over
find
that.
some common ground. So it'll be
Exactly.
interesting to see.
Yeah, and he also believed that vaccine cause um well, he doesn't believe that vaccine. He's concerned about the preservative, thimerosal in
Yes.
vaccines,
Mhm.
that he believes also cause autism. But I want to say that most vaccines, if not all, do not have thimerosal as preservative right now. So
So what is the concern then?
the concern was about the preservative,
Yeah,
but
if that's not there, what's really their basis?
I don't know. You asking me? I don't know about that, man. You
Oh my
know, and the so that's him, and he's going to be what is he going to be doing? Dave Weldon. What is he going to be
God.
doing?
I don't even know what Weldon's going to be doing. Oh, we'll head the agency, CDC.
CDC. Yes.
CDC, yes. The
So the
Florida
CDC.
congressman will run the CDC. But go ahead.
So the CDC is the one that um do the vaccines,
Uh-huh.
that the vaccine schedules, what vaccines, pediatric vaccines need, what vaccines children needs to take when, and things like that. So you have somebody that's going to head the CDC that that have concerns,
Mm-hmm.
okay, over vaccines and their efficacy,
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 yeah.
efficacy. I made up a word, efficacy.
Right.
Their efficacy and their safety. That's
Mm-hmm.
going to be ahead of CDC. So again, popcorn to see how that's going to play out.
But as we put butter on the popcorn, let's talk about the FDA commissioner, who will be Martin Makary, who's a
Okay.
Johns Hopkins surgeon who's been nominated for the position. And he actually believes in vaccines and says that vaccines saves lives, but also as it's a good thing to question the US vaccine scheduling for children. So
See, that's kind of like the same thing that we just said at the beginning, that you can be for vaccine and
Mhm.
question the scheduling of it, right? And that doesn't make you an anti-vaxxer just because you are uh, questioning the scheduling of it. He actually is one of the nominees that I agree the most with,
Uh-huh.
right? Um, he was against restriction during COVID. Like he felt that the quarantine was not um, really warranted, that you didn't need to put people on quarantine because then herd immunity would have taken over. But my thing is, I worked in a hospital and we had so many deaths that I feel that by the time we get to the herd immunity, that we would have had a lot of people dead.
Survival of the fittest. I mean, really, it is survival of the fittest.
Judith is like, you would have taken the weakest out of commission.
And basically, that's what was happening. The weakest were dying.
Like
Individuals that
he,
had underlying disease states, they were. If they
mhm.
were in that first wave, that second wave, they were gone. Hey, look, I enjoyed the shutdown. I mean, it was
Well, that's because you
relaxing.
like to stay home. You didn't have to, and also you didn't have to drive all the way from Delaware to Philadelphia. That's
Yeah,
why.
I did, and it was absolutely enjoyable. I could work out at home. I could take long walks with the family. I I I took full advantage, but there are people like I am an extroverted introvert who are just
Mm.
extroverts that need that daily contact with people. I did not. I don't need anyone to charge my batteries. I'm good. So, but
You're so
also
powerful, you don't need batteries to play. That's yeah.
I got my internal, but people will drain me after a while.
Well, anyway, he's like against all these restrictions during COVID.
Uh-huh.
But he has a lot of publications against medical errors, over treatment, and
Hmm.
that's why I said that he's the person that I have the least issue with,
Okay.
because he has concern, and you need to question the medical industry, right?
Oh, you
Because
do.
like
You
every
do.
industry, like the healthcare industry, the medical industry, like all industries, if left unchecked, if left unquestioned, they can go rampant, and before you know it, they're doing things that you're not really supposed to be doing.
Mhm. That's why they're guidelines.
Right.
You have to have guidelines.
And
But
that's what I think will happen with a lot of these nominees, that a lot of the guidelines are going to be changed.
mhm.
I don't know if it is for the better. I don't know if it is for the worse, but it's going to be changed. The way that people practice medicine, the way that practitioners, providers practice medicine, the way that they get paid will be different,
Yeah.
you know?
So maybe it's time for a change. We're going to see if it is actually for the better. But
Right.
okay, here we go to our favorite one, the Trump selection for the head of the NIH. And I'll let you say the name.
Oh, I was going to let you say the name.
Okay, it's Jay Bhattacharya. Yeah, yeah,
Bhattacharya.
Bhattacharya, which we'll just say,
You were calling the man at the beginning Dr. Bachata.
but
Dr. Bachata.
Hey, it's the holiday time, okay?
I was like, okay, the men will be like the Dominican bachata.
Ooh, feel the moves, feel the moves. But also, he is a supporter of vaccines. So you really do have a balance of anti-vaxxers with people that support vaccines but question the scheduling. So there may be some common ground, but it will be interesting to see how they actually work together and what changes actually occur.
Right. And him also was against the COVID isolation. Like he was against the COVID isolation. A lot of people were against the COVID isolation. Okay? A lot of people were against the COVID
They
isolation.
just want to go to the gym.
I thought that if people wanted to chance it, let them chance getting the disease because some people were wanting to get COVID. So let them chance it. And that's like you and well, I practice personal responsibility. You take care of your own health, you take care of
Yes.
everything yourself. Um, because nobody else is gonna help you, nobody else is gonna protect you. You
Mhm.
have to protect yourself. If they're telling you stay away from infected people, then you stay away from infected people, right? If you choose to go and be with infected people, whatever happened is your problem.
Yeah. Well, they remember they were having COVID parties like it was chickenpox parties.
Right.
So once again, people are going to do what they want to do.
And also with that isolation thing, and like when COVID first happened, I know many employees that kind of like milked that thing because people were like, oh, if you feel like you were
Mhm.
exposed, then you get to stay home. Because I never got the choice of staying home
Yeah.
during COVID because who's going to take care of the patient if people that are in the hospitals is home? But I do know some employees were like, I was exposed. How were you exposed? Oh, we had a get together. Why were you having get togethers? You know what I mean? Why were you having get togethers with 50 people?
I, look,
And I was
personal
exposed. And then they
responsibility.
will send them home and stay home for 7 days. Those people were taking 7 days off on purpose.
Well, they had to stay home. They couldn't fly anywhere.
They were they wanted to stay home. That's what it was. They wanted to stay home.
We know they wanted to stay home. We know even us as remote workers stayed, had, the opportunity if you were, you know, exposed. But no, I never did. It was just, what are you gonna do?
Yeah, and this is the thing about isolation and not taking. I actually did not catch COVID until 2023, right? Like late 2023. And
Hmm.
I was upset. You know why I was upset? I caught COVID after all the
Hmm.
what do they call them? All the incentive for having
It was
COVID
gone.
were
Yeah.
gone. Right? Uh,
I- yeah.
Why did I? And I feel that could be, and people were like saying, "Oh, maybe you have something that prevent you from catching COVID." I'm like, no. The reason that I did not catch COVID is because I was wearing my mask,
Yes.
right? And I were in a hospital where everybody was wearing their mask because it was mandatory for you to wear your mask.
Hmm.
When I would go out in public, I would wear my mask, and I got very bad look. This being Florida, they will
Yeah.
give you look like why are you wearing your a mask? But sometimes the look that I gave you were like, don't play with me. You chose not to wear your mask. That's your problem. I'm wearing mine. Okay. And
Well,
don't
look,
come too close to me. Don't come too close to me.
look, I also caught it later on, but it was like 22, like towards the end of 22. Why? Because I went to an event for one of my children and I said, oh, let me raw dog the air. But the only thing I will say is I coughed, took a test, went back to work, didn't even look at the test. Then when my child came home and said, hey, you have COVID. I'm like, oh, craps. I just continued to work because it wasn't severe. It wasn't severe. So
Thank God.
yeah, thank goodness I was lucky that it wasn't severe.
No, I took all the precautions that they told us to take
Mhm.
because my butt at the time had uncontrolled diabetes, and I was seeing that, and I was obese, not even overweight. Right now I'm overweight, but I was obese, right? And all the people that I saw that were like dropping dead were
Mhm.
obese people, people with diabetes, people with underlying conditions. So I was like, I'm not chancing it. I'm taking all the precautions. I'm not going to fight. And don't come near me. Stay 20 feet away from me, you know. And they were like, oh, but it's 6 feet. I don't care. Stay 20 feet away from me. You're not wearing a mask. So stay 20 feet away. So that's what I did. But a lot of people were against COVID isolation. And I actually, the COVID vaccine mandate, you give people a choice. You either take it or you don't take it,
Yeah.
right? But if you choose not to take it, here are the things that you have to fulfill,
Yes.
you know? And that's that. That's your choice, right? And I think by mandating it, people just kind of like rebelled against it. I know people that lost their job that
Mhm.
because of that. They didn't get fired, but they just preferred to quit rather than take the vaccine.
To travel, to go to other countries, you need the vaccine. You need to show that you were vaccinated. It was just part of life at that time. But hey, we have another person, the celebrity of the group,
Oh,
Dr.
last but not least,
Yeah,
we left the best for last.
the
Dr.
best friend,
Oz.
Dr. Oz, Dr. Emmett Oz, who's going to be head of the Center of Medicare, Medicaid Services, which is
I
within,
blame Oprah.
yeah, Oprah fame.
I
Okay.
blame Oprah. Oprah.
Now she knows who's her friends and who's not, okay? It's going to be an agency within the HHS. So just remember who Dr. Oz is. He also says that vaccines are oversold. He promoted, and everyone can have an opinion on that. He promoted the use of the anti-malaria drug,
Oh, hydroxychloroquine.
hydroxychloroquine, as a treatment.
You
And
know, we thought we purchased like $10,000 worth of hydroxychloroquine.
yeah, that's right up there with injecting Lysol. I don't know what to tell you.
Bleach, injecting bleach, injecting bleach. No, so none of these things. Okay, that's why people have studies, right? That you have
Exactly.
studies that you can see. You have okay, that you have randomized blind, double blind studies. Like
Studies.
the physician doesn't know what drug you're taking, you don't know what drug you're taking, right? Only
Correct.
the data analyst and things like that know what drug you're taking. So that way they know what works and what doesn't work. Yes, hydroxychloroquine could work in some patients. You know what also worked in some patients, Judy?
What?
Hot water. Okay, okay. Hot water. Tea.
I didn't know you were going to say that.
Okay, tea.
Chicken noodle soup.
Chicken noodle soup. Like, what was it that my sister was giving me when I caught COVID? Um, ginger tea,
Lemongrass.
lemongrass, ginger tea,
See,
mugwort, you know, artemisia, you know, and it was like, I was like, okay, I think I'm all teed out.
hey, but you're still here. It was the tea.
Yeah. And but that's why I said that's why you need those studies to kind of like show which things worked and which didn't work.
Well, let's
Okay.
hope they will continue studies in this next administration.
Let's hope so too. But also, Oz, the problem that people have with Dr. Oz, he's very prone to promote
Oh,
supplements, right? And I know that supplements help, right?
yes.
But in an acute case, supplements will do nothing. Okay. Um, in a chronic case, maybe, okay, maybe, but not in an acute case. In an acute case, like I said, hot water will work.
So, he is a celebrity doctor. Not that he's not a real doctor. He is.
He doesn't just play one on TV.
He just doesn't play one on TV. So, and we don't play one on TV either.
No,
We're actually real pharmacists. So it's going to be, I said, this is going to be a very interesting take on healthcare for the next 4 years. So I am interested to see how it plays out, how these changes, if they go through, because right now, these are all nominees. They do not,
right.
quote unquote, have the job. So,
Right, they are just nominees, and I do
yeah,
say that before people go like the sky is falling, these
yes,
people are going to like are crazy, they believe in crazy stuff. Let's see what they do because
no,
certain things have to go through Congress in order to pass. Let's
yes.
see what they do, right? There are rules that are there already that
Hmm.
govern healthcare, and to unravel these things, you have to really pay attention to all those little details and all those little rules and regulations that you have um to do. And who knows, it might be for the better if anything happens that they change healthcare to the point that people have to pay attention to their own health. People have to take accountability to their own health, that you get more health coverage, even though I hear that Obama, well, the Affordable Care Act, I
Yeah,
almost said Obamacare, is
no
gonna
such thing.
go, oh, is gonna go away. The Affordable Care Act might be going away. Um, Hopefully, people that doesn't happen, but that people get more coverage for more chronic diseases, get more coverage for preventative diseases, so that you can take care of things earlier.
And I think we really do need to take responsibility for our health. And we would love to see that, but
Yeah.
in moderation.
Let's see what will happen, and
Yeah.
let's pull out our popcorn and a glass of water, and you take the glass of wine, and
No, I'll take a glass of water. We can do mocktails. How's that?
oh yeah, but a sugar-free mocktail.
Sugar free, yeah.
Yeah. And kind of like see what happened. And I think with anything with this administration, is kind of like, let's see what they do before we go out and start going like, oh my God, we have
The
to do
sky is
this,
falling.
and
The
the
sky is
sky is.
falling.
Yeah, let's see what they do. Let's see how far they can go, and let's see what they do in terms of healthcare. Like you said, let's take care of ourselves,
Yeah.
take care of you.
Take care of you.
All right, that was it for us today, about all the nominees that Trump had have nominated for these posts.
Yep.
If you liked the our
Discussion.
talk, our discussion, our talk, I'm like having a junior moment. I have a boss, that's what he said. I'm having a junior moment. If you like our discussion, please like, subscribe, and share, so that our channel can grow. Right now, we have very few subscribers, and hopefully by middle of the year, we should have at least 1,000 subscribers, 1,000 to 5,000 subscribers, and we can only do that with your help. So
So yes, please like, click, and share.
yes, it was we had a great time
Yes, we
sharing our conversation with you, and we'll see you later. And if you want, you can watch any of the other videos that we have over here, over here, over here. Okay.
everywhere.
Yes. Thank you so much. Have a good
Thank
time.
you.
Take care of you.
And don't forget, we are best
Best
friends
friends
on
on
drugs.
drugs. Yes.
Bye.
I got the issue. You speak slower and I speak a lot faster. It's okay.